Alright, hi everyone from Chennai airport. So I thought I would record this video so that you have your explanations. So let us start with glaucoma part 2 cornea, and I will start the quiz like I did. So I am ready. Alright, so the first question for me is a ceton surgery. All four are glaucoma surgeries, but ceton, I know this, is a Latin word, and Latin word ceton means drainage implant. So the correct answer is of course drainage device. If I quickly tell you something about this, you need to know the image of the Ahmed valve implant made up of silicone polypropylene. Then there are three minimal invasive glaucoma implants that are very small. Image is not required, but express implant made up of steel, iStent made up of titanium, and Zen implant made up of gelatin. All these are ceton surgeries, means implants to decrease the intraocular pressure by increasing the drainage of the aqueous. So that is a straightaway answer, drainage device. Now the clinical question, one day after trabeculectomy means glaucoma surgery, a patient was seen on slit lamp. The findings were very low intraocular pressure. 4 is very low. But the serial test, shallow entry chamber and low intraocular pressure. But serial test was not T here. Serial test was negative. If serial test is negative, I will rule out wound leak, because in wound leak, serial test has to be positive. That is fluorescent dye you put and the aqueous is coming out, the aqueous gets diluted. So I rule out wound leak. Wound leak can have shallow AC with low IOP, but that is not the answer over here. Aqueous misdirection and pupil block are reasons of shallow AC but high intraocular pressure. So straight away, even if I don't know anything about this, answer has to be over filtering. This is over filtering bleb. Means increased drainage is there, that is causing low IOP, shallow AC. Now audio.
A 22-year-old was playing cricket
ये 22 साल का लड़का फिर आ गया. कल पिक्चर देख रहा था, आज क्रिकेट खेल रहा है. इसको काम धाम नहीं है क्या?
and he was hit by a ball in the right eye.
Injury.
Now, with pain, he went to ophthalmologist who saw that the intraocular pressure was 35 millimeters
35 is very high.
and the visual acuity was with finger counting.
Very
On
low.
slit lamp, the full anterior chamber was filled with blood.
Okay, so that is hyphema. So which is false for this. तो 22 साल का लड़का क्रिकेट खेल रहा था, चोट लग गई, went to the ophthalmologist, was vision was very less because the anterior was filled with blood, that is hyphema. And hyphema there is high IOP because of secondary open angle glaucoma, because the blood can block the trabecular muscle. So that is a true statement. Now topical steroid with cyclogenic is given to decrease the inflammation and decrease the silly body spasm, to decrease the pain. Now you say, sir, topical steroid will increase the pressure. That is why topical anti-glaucoma medication is also given now. So A, B, C are correct. And he is advised to have the head up, not the foot up. With head up, the blood will go down, the clarity of the center of the pupil will be there. If you have a foot up, more blood will be there, and he will be able to see. Same concept for vitreous hemorrhage. You have to head up, reclined position, 45-degree head up, so that the blood goes down with gravity and the center media is clear. That is the answer of this hyphema, secondary open angle glaucoma, blunt trauma. Now, which of the following is not maintaining, does not maintain transparency? Epithelium maintains, is a multi-layered. It acts like a barrier, prevents the water to come inside. Endothelium is the most important. I know it's a sodium potassium ATVs pump. It pumps the extra water out of cornea. Keratin sulfate in the stroma is also very important because it maintains the stromal pressure, which does not allow the aqueous to come inside the cornea. By glaucoma is a glyconoaminoglycan, that is most common keratin sulfate. But Descemet membrane has no role in maintaining the transparency. That is a straightaway answer. Descemet membrane. The image is given, which is deposited in the cornea. Here the image is this. Now image, even if I don't know anything about the image, I know because I have given the question. Even if I don't know, I should know that copper is in the periphery like a brown ring, cases precious ring. That is not the answer. Now there are different iron lines actually. Here also there is an iron line, but main is this whitish deposition, that is calcium deposition, a band like a horizontal band, like a band shaped keratopathy. That can be seen in silicone oil in the eye, chronic eye conditions like chronic keratitis, chronic glaucoma, chronic uveitis, or phthisis bulbi, where the eyeball is shrunken when the vision is lost. That also can have calcium deposition, band keratopathy. If I would have asked the question, what is the treatment of this? Then the answer is EDTA chelation to dissolve the calcium. So that is a calcium in the Bowman's membrane. That's the answer. Another condition, audio.
A 16-year-old female girl
No, I know this. I have given
was
that 16-year-old female girl has -2 diopter sphere with -4 diopter cylinder. Means myopic astigmatism is there. Now she has a visual acuity 6.6 and what was there?
complaining of
भूल गया मैं.
frequent changing
As
of
frequent change of glasses, yes.
since the last 6 months.
Topography was done in the vertical axis 42 diopters, horizontal 46 diopters. That's why there was astigmatism of 4 diopters. What is the scenario? A young patient, frequent change of glasses and cornea curvature is increasing. 46 diopters is quite increasing with astigmatism. Staphylomas is a complication of corneal. Now you know the answer is keratoconus, but there is no option keratoconus. No corneal dystrophy, no infection is given. It is corneal ectasia. You should know keratoconus is ectasia means thinning of the cornea and bulging of the cornea, and that is keratoconus. One example of corneal ectasia is keratoconus when the central cornea is bulging, and that is happening in this girl. But you should do refraction, myopic astigmatism, but the patient is not compliant to cylindrical glasses, so rigid gas permeable contact lens is given. For progressive keratoconus, C3R procedure is done, corneal collagen cross linking. For non-progressive, there is an intact intracorneal ring segments of PMMA in the stroma is put. But for vision loss, advanced disease, keratoplasty, optical keratoplasty is done. Optical means to increase the vision. Now audio.
A 5-month-old child was brought by the parents. The mother says,
अब ये कभी why is this 5 months old child what does the clinic by parents is okay, mother says, why always mother says? Have you noticed always it's mother says, father says कभी नहीं होता. Why should always mother say? Have you heard of a question father says? At least you can say like this now, real practical situation of life. Father says in bracket लिख दो कम से कम, if mother allows, ऐसा लिख दो कम से कम, तब तो माना जाए ना. हमेशा mother says
that always there is watering from one eye of
watering.
the child.
Okay.
And the child is not able to look into the normal light.
Not look into the normal light, watering, that is photophobia watering. Megalocornea is ruled out because that is only enlarged cornea. There is no symptom in that.
Also, she noticed that the eyeball size is slightly bigger.
That can be seen. That is looking like megalocornea, but there is no symptom in megalocornea. In congenital dichrocystitis, there is no photophobia. That was INSCT question. Dystrichiasis can cause watering and photophobia, but the eyeball size is not enlarged. Directly, the answer is congenital glaucoma, ophthalmos. Goniotomy is the treatment of choice. I just told you this. Keratoplasty done to improve the vision is optical keratoplasty. To decrease the infection is therapeutic. To maintain the shape for cosmetic regions in only anterior staphyloма tectonic. And this is artificial cornea. Keratoprosthesis, Boston and osteodonto keratoprosthesis. Answer is optical keratoplasty. Now, what's the diagnosis of this? 28-year-old patient has progressive dementia, jaundice, rigidity. Jaundice, liver is involved. Rigidity, dementia, basal ganglia is involved. There was a brownish pigment seen in the cornea. This is casus fleches ring. That is Wilson's disease. Which of the statement might not be true? Corneal findings are pathognomonic is not true. It can be seen in cirrhosis, chalcosis. That is the answer. Yes, gonioscopy is an early investigation because it is involving the Descemet's membrane that is in the posterior cornea, and the first structure seen on gonioscopy is Schwalbe's line. And corneal findings, yes, can be used for monitor because if you treat Wilson's disease, the ring goes away. So A is a wrong statement and the correct answer. Okay, now this is the cornea. If you see, this is a full thickness opacity of the cornea with iris is plugging. So nebula is less than 1/3, macula is 1/3 to 2/3 opacity, leucoma is more than 2/3 opacity. This is not leucoma along with iris has adhered. This is adherent leucoma, one of the complications of corneal ulcer, and that is the answer of this question. Thank you very much. I hope I am not missing the flight. Best of luck.